Yes. Okay, on Saturday, two mothers walipoteza watoto, walikuwa wanaelekea kwenda kujifungua, lakini unapata tena ile facilities zetu yenye tuko nao kwa county, most of the time on Saturday they are not on. And now that we have the strike, a number of even other cadres have taken advantage of not providing services in the facilities. Yesterday I was in person in Riverol Hospital in the morning. The people that you can meet there is only the cleaners. No one is in the facility. If the nurses are on the strike, what about the pharmacy? The pharmacy should be open so that the members of the public can get the cheapest drugs in the facility. The dentist, those people who are dealing with the dental, they are not there. Those who are dealing with the ENT, they are not there. So we are calling upon the county government to call back all the staff, all the cadres who are not on strike, so that our people can access anything to do with the service that the people of this county needs. At the end of the day, it is our role as the leadership. It is our role as a leader. You know, the people of this county, on 8th of August 2022, went to the ballot and voted us so that we can defend them, not the nurses to defend them. So I'm calling upon the governor, I'm calling upon the CEC in charge, I'm calling upon all the leaders, including our senator, to come down here and also argue the basis on how our people can be given the fair justice in terms of the healthcare services. Umemaliza hiyo? Okay. Betutab raini ko koib nafas ko aenge kandoikab Kericho County ni kiguren Amatya Arap Korir ako IMCA nebo Chai Ward ako chairman nebo Labor and Governance. En betutab raini ko koib kityo nafas akon kurset en biik chekokobet sobonwek, biik chekoseretyo biik because kikiker level 5 hospital. Kingeker level 5 hospital koek affected kora the other facilities chematakosikyi kovaren service anan konyor konyoiset biik kyok en Kericho County. Ko kanyor raini saboit asom ale ndamukokse kingen kele tindo takitariek anan nurses haki nenywan, lakini nesire tugul kotindo kora biikab Kericho County anan tindo kora mugonjwa haki kinya en ele kosomen toretet nebo kerichek. So kasome raini alechi governor nenyon Dr. Eric Mutai, asom kora senator nenyon Aaron, asom kora MPs chechok, kakoit ele yoche ketobot ko ki kandoik ak kekon solution on how we can provide service en raia. Another thing is miten daktariek cheyanat en Seria akot kikipitisan en county assembly ni ako kitinye nguni public service board. Imuche konyo daktari on the need basis. Kwele muche konyorundo daktari on the need basis, that is the nurses, ko muche konyo koib nafas nebo 1 hour ako ker biik chekaimuch konyor en ano en emergency anan en waiting pay. So I want kasome kityo ale ndamukokse health department ke budgetini rabinik chechang. Mamiten department nesire health department ke budgetini more than 3 billion chemuche koketen boisiet nebo keker kele kanyor biik konyoiset. So kakur raini en betutab raini ale ndamukokse even governor speaker nenyon komuch kotil recess nekimiten en koki MCS akokur special sitting through the majority leader so kobit nyike discussen this issue because kakobek biik en barabara. Ndewendi nguni South Rift mami parking akot highway and then kokoib biik title ko en sipitalishek cheterter because kakoek kali kerichek. Koiku kali kerichek because akot biik chemamiten strike chelele miten ngole gavana nguno miten biik strike iyoni kele miten nurses strike, lakini kali amayotwe pharmacy sikakesirchi chito kerichek en private facility konyokwal en sipitali nebo county at a cheaper price. So kisome kityo kele ndamukokse koteke responsibility governor, CC ak MCAs ak kandoik tugul koker kole kakisoru biikab Kericho chekakobek en oret. Kokibetoin en weekend lagok oeng chekikimekesich en Kipkelion kosikibet lagok komamiten chito nekimuche kwatenden. The same thing miten chepyoset nekichutyi kichut ko en gate nebo facility ako mamiten chi nekimuche kotoret biikab bodaboda and I want to thank them. So issue nebo sipitali koma kit nekiyoe siasa, kisome kityo kele ndamukokse ketobot ak keng'alal ak keker kele kitoretito ano biik kyok chebo Kericho County. Yes.
national government SRC.
Yes, kole county government issues chetindo nurses kobo national government. Makitinye ngal kele bo national government ana mabo national government. At the end of the day, the bottom line, ko lazima kinya chitab Kericho. Makinge kele inyoe netindo issues ak national government ana netindo issues ak county government. So kisome kityo governor koron kotomo keker chebo national government onge our bit as the county government. Onge provided what we need to provide to them. Sikalianinye. So komuche ot kotesta. Ku nombo locum ndakatindo locum. And then chito nenamu payroll nebo nurses is not the national government, it's the county government. That's why we allocate 3 billion every year for the salaries and for operations of the facilities. So why are we allocating 3 billion and when it comes to issues kinyabi keleba national government? It is nothing like to do with the national government. If it is nothing, kotindo kit nemuche koyai national government. Why national government? Lakini yoche kekera keche kele kokitoreto no biik chekakobeken barabara. That is the basic. Keker kele ketoreto no chito. Yes. Kit kityo nosome biikab emet angen ole kitesetai kemuitoi, kitesetai kechile, kitesetai kelionen. Lakini yon takoibe nafas county government ak kandoikab Kericho ni koker kele kaamwanda ano ng'alekab nurses. Amoche kityo asom ndamukokse korosom multinational kong'eu James Finlays anan kuren Browns koyotwech kurget en Chomogondai facility. Sindamuche kou koromit keba ano keba Chomogondai, ndabore kokoromit keba Central Hospital because imuch koboisie SHA and then another thing ko SHA kotindo limits. Miten betut nebeku SHA. Otiwe private facility nekakitokyol kinyoin ak 10,000 kikonyain ak 30,000. Ko karo maimuchi te access and iboisie the facility of the SHA. So kasome na ka-appealen ole if it is possible ongebwan koki kandoik ak provide the lasting solution to our people. Kabianga tifam ko kiami last week kikowek biik kasit so unless omoche arabachen kityo. Okay, last week kwa chama nebo labor kokikowe boker issues chebo Kabianga tifam akibe keng'alalen ak committee akiyonchinechi tuguk chechang. Lakini amoche asom kora serikalitab county government kondochin His Excellency ak CC in charge of agriculture kotakokochi kerset ak kokochi kimnotet kiboitinik chemiten Kabianga tifam sikomuch koproviden kora service cheyomotin. Ki genuine concern chebo Kabianga tifam, very genuine. Otinyoru chito netomo kerimiten NSSF SHA for 9 months kokebar chichono. Ndamiten kit kele kabit kit nemoyoche kobit ko kaumian chichon because kawo gaa akikwai kasit for long. Kitinye kora Kabianga tifam ko kimopeni holidays. Holidays komoliponjin kiboitinik. So koki agree on some issues ako kifacen yaut. Netai ko kokilechi kosubmiten koyai remittance chebo NSF ak koyai remittance chebo SHA on time simoseretyo biik. Another thing ko kokiyonjine because tindo CPA kikosignan ak biikab Kabau ko kokiyonjine kele ndamukokse kiyan ak keboisien ot ko beitab chaik ngamun bichundo komonegosietendo ano so simaumianso akichek ano Kabianga tifam. Kit kityo nosome kityo ko ngamun kitinye issue nebo haddock en assembly ni nekinomi next week. Ko nginomi next week haddock ko kikosom county executive 21 days. So ako nenon ko mamiten kele kiyoe kechenge chi netot koek ne. Kichenge kityo keleleni kingekonu. Nebo makitinye ng'alek alak tugul ako kiwisheni chi tugul chemiachen yo prepare neso nyokonyorwech en assembly. So I think kidogo. Yes. Standard media that the governor and the county public service board entered to an agreement with the doctors, with the clinical officers, with other cadres. Why are not there? They are not in the facility. You know, I'm being shocked. You know, when I visited the facility yesterday, and I felt that it is wrong. because we are paying people salary who are not working for us. In fact, we are paying some doctors who are not even in the facility. The consultation fee that one of the Kericho residents would have taken to a private facility, those doctors could have been in the facility, they could have solved that problem to see whether that the patients need advanced treatment or what. So I'm calling upon them. The agreement was signed, and I want to thank the governor and the CEC and even the Public Service Board for entering to agreement. Although I'm told the agreement has not been honored so far, but I know the agreement was entered into and the deal was agreed. So I wish that the doctors, the clinical officers should go back to the work and at least open the space for these residents to get service. Yeah? Oh, hapo majuzi tuliona gavana na watu wa Public Service Board waliweza sababu hii mgomo ilianza na madaktari, na vile ilianza na madaktari, gavana akachukua jukumu, wakaongea nao, wakazungumza na wakakubaliania, wakaandikisha return to work formula. Na vile waliandikishana, mimi nataka tu niombe madaktari, nyinyi maneno yenu imetatuliwa. Mbona sasa yuko kwa facility ama huko penye unastahili kuwa unafanyia kazi, ili hali wewe ulishakubaliana na county government, pia clinicians or clinical officers, nyinyi mlizaa kubaliana na county government kuwa yale yote itakuwa inazungumziwa, ama hapo itakuwa ikifanywa, itakuwa ni vizuri ukue kwa kasi pia. Tuko na madaktari pia wenye wamehudumu kwa muda, tuko na waguzi wamehudumu kwa muda since 2019 ama wengine mpaka 2018, mpaka saa hii hawajapewa permanent and pensionable. But I know tukiendelea hivyo wataweza kuwa confirmed, so that they will be able even them to be in a better job groups. So I want to appeal to them that let's go back to work. If it is possible, the county executive, the CEC in charge of health, to give an internal memo, give them a notice that they need to go back to work. Because at the end of the day, we are paying salary. This is the high budgeted department. We are allocating 3-point-something billion every year. Thank you.
Thank you.